Greetings, YouTube. The other day I was listening to an interview on a public broadcasting station out of Boston, WGBH, I think it is. And it was discussing a program that had gone on, a study that had gone on, dealing with the homeless and their health care, or I should say their lack of health care. And the study had covered 119 homeless people, which they tracked, I think, for over a decade. And over that time, half of them died. And they didn't die of the things that you might associate with being homeless. They died of heart disease and lung disease and cancer. They died of diseases that could have been treated if they had shelter and had access to adequate health care. Now, that in and of itself is a tragedy and is an indictment of the entire American society, that we allow this to happen in our nation. Arguably the most powerful nation on the planet. It just sickens me that we let this happen when there are better solutions. But they also looked at the incredible cost that these homeless people had upon American society. And you're probably asking yourself, well, how can these people have a cost on American society? They are homeless. They shouldn't have any cost to the American society, correct? It's kind of the point behind the fact that they are, the unwashed, unwanted, invisible people of our society. Well, there was a cost. Of these 119 people over the course of the study, they accounted for 18,000 visits to emergency rooms. 18,000 visits. Now, what's that going to cost the American people? Because remember, when there's no one to pay those bills, we, the American people, pay those bills. So, there's no one to pay those bills. What do you think that runs us? $1,000, maybe $2,000 a visit? For that kind of money, we could have put all of those people, just one of those visits, would have paid for a month's worth of rent in low-income housing, plus their necessary utilities. Toss in another couple of visits, and you've got their health care costs covered for 6 months. So for a fraction of what the American people paid to cover the health care costs of these people, half of whom died, we could have made sure that they had shelter, food, and adequate health care. We are being penny-wise and pound-foolish. We are allowing people to say, those people over there are causing our problems. Well, you know something. It's our lack of humanity, of empathy, of sympathy, and compassion that are causing our problems. If we would start thinking about all of us, if we would start thinking about we the people, we would not only save lives and treat everyone humanely, but we would save a huge amount of money. Now let's be brutally honest and pragmatic. That's important. Yes, saving lives is number one, but saving hundreds of thousands, millions of dollars from being wasted because we won't do the humane thing and pay up front to make sure that no person in America is ever without shelter, without food, without clothing, without an adequate education, and without health care. These are basic things, basic aspects of society. These are the foundations of society. And yet, we fail miserably at them again and again and again. And yet, we're willing to pay for all those emergency room visits because we're not willing to step up to the plate and say, hey, we need to make sure these people have a place to live. It just baffles me. And in how many days from now, it's going to time for another voting election cycle. And how many people are going to vote for policies that are going to cut the funding for these very people again? And yet, we will still pay for all of those visits. But it just won't be on anyone's radar. Nor, apparently, will all the deaths.